Yeah, some pregnant women will always complain that their legs are getting swollen. It's very common now. You see your legs are swollen, right? Your legs are swollen, and um, you will notice that the legs are swollen not in early pregnancy, not in the second trimester. Is okay, yes, in the second trimester, but late in the second trimester and in the third trimester, when the pregnancy is progressing. Do you know why your legs are swollen? It's because of your baby is increasing in size, and because your baby is increasing in size, your baby is now pressing on the veins that are supplying your leg, and it's supposed to take away blood from your legs, from your lower limbs now, from your legs and your feet, because the baby's head, buttocks, whatever, and the womb has also increased. Is pressing on those vital organs like the blood vessels supplying, taking blood away um, from your legs. What happens if something is blocking something? If something is blocking a pipe, what happens? The pipe will not be able to carry out its function properly. So that's what happens. So because the baby's head, or the baby that has grown now, increase in size, is pressing on the veins that are supposed to take blood away from your legs will start getting swollen. The leg blood will be accumulating in your legs. That's why they will always tell you to elevate your leg in a pillow when you are pregnant. Put your leg in a pillow, you notice that it's swelling. That's why you notice when you put your leg in a pillow in the night while you are sleeping, right? When you wake up, the leg will go down. By the time you start moving around again, eh, the leg will swell up again. That's it, right? And it's also the reason you are urinating more often. Maybe I'll talk about that in another video. I've talked about these things before. It's also the reason you are urinating more often. The baby is pressing on the veins that is supposed to take away blood from your legs. That's just the issue. Eh? But a caveat, I want to warn you of something. If your legs are swollen and you go and do urine tests, you are supposed to be doing urine tests every antenatal visit. You go and do urine tests, and they tell you there's protein in your urine, and also they check your blood pressure. Your blood pressure is high, right? that may that means that leg that is getting swollen, especially in early pregnancy, in the first trimester, in second trimester, maybe at 20 weeks, you notice that your legs are already getting swollen, your BP is high, and there is protein in your urine. That is preeclampsia. It's different from this one I'm talking about, that the baby will just increase because the baby is growing, it's pressing on your veins, and the blood is not going back to your heart. It's preventing the blood from going back to your heart. So they are accumulating in the leg. So take note of them. That's why every leg swelling, every feet, when you notice that your feet are swollen, you are supposed to discuss it with your doctor so that they will check your urine and blood pressure. It's when after they've done this that they'll say, okay, this baby, the reason your legs are swollen is because the baby is growing and the rest. I hope you understand this. I'll talk about the urea in another video. Thank you. Please, I have a Facebook page. You can also follow me on Facebook. I will reply you. I will follow me there. Please, I'm begging you. Follow me on Facebook. I'm also on YouTube. But my YouTube handle and my Facebook handle are right in your screen. Thank you, and bye bye.